Hello. Today we're going to talk about business ethics, rules, regulations, and client satisfaction. Type of private home care services. Personal support helps client to perform all activities of daily living, bathing, dressing, toileting, ambulating, feeding, and vital signs, as well as homemaker tasks, light housekeeping, laundry, meal preparation, and errands. Respite care provide relief to caregivers. Companion or sitter services. These services are provided by qualified and trained PSAs and CNAs under the general supervision of a registered nurse. Private home care services. In general, the goal of these services is to assist clients with all personal care needs, to provide relief while recovering from all illnesses or injury, to assist with home management tasks, and to prevent hospitalization or placing into nursing home. Our prevailing goal is to help our clients to maximize independence in the comfort of their own home, because being home is always better. Personal care tasks mean assisting with bathing, either in a tub, shower, or bath, routine skin and hair care, general mouth care including dentures, grooming and shampooing hair, nail filing, knot clipping, or cuticle cutting, assisting with dressing and or toileting. Companion or sitter tasks mean meal preparation and serving, household tasks essential to cleanliness and safety. Home management tasks mean grocery shopping, assisting with bill paying, assisting with scheduling medical appointments, proper nutrition, preparing meals and washing dishes, encouraging proper nutrition, assisting with eating, observing and reporting meal accumulation and food storage or cooking equipment failure. Housekeeping or housekeeping tasks mean activities performed to keep the home clean: vacuuming, sweeping, dusting, mopping, taking trash out and garbage for the client, doing laundry for the client, cleaning rooms for the client, changing linens for the client. Medically related activities means observing and reporting changes in the client's condition, applying first aid in case of sudden illness or accident, arranging trips to the doctor, picking up prescription medications, accompanying clients on medical appointments as necessary due to client's frail condition, reminding the client to take medication, assisting with self administration of medication, providing watchful supervision and oversight during the absence of the caregiver. Transport and escort services means accompanying the clients or providing or arranging transportation for clients to places outside of their residence for purposes such as doctor's appointments. Transfers and ambulation means assisting in and out of bed and wheelchair, assisting with walking, encouraging physical activity, if appropriate, assisting with simple exercise program established by nurse or therapist. The home care department offers personal support services in Cherokee, Forsyth, Howell, Cobb, Douglas, Fulton, DeKalb, and Gwinnett counties. Medicaid home and community-based VA programs. MedSite is reimbursed in one of the two ways. Private pay clients, we offer competitive rates for self-pay arrangements, or Medicaid waiver programs. The main reimbursement programs are SOURCE, NCCSP, EDWP. Medicaid eligibility determines which waiver program the client is eligible for. We can help to apply to home care assistance programs, so the prospective client should call MedSide's home care intake to find out what benefits he or she can qualify for. A referral can be sent to hcintake@medside.com. Policies and procedures. MedSide is a private home care provider licensed by the Georgia Department of Community Health. Must follow DCH licensure rules and regulations in order to offer services to the public. If rules are not followed, the license can be revoked. MedSide is enrolled in EDWP, Elderly and Disabled Waiver Program, CCSP and SOURCE, to provide a range of supportive services in the members' home settings under Medicaid. Must follow Medicaid rules and regulations to get paid for services. If rules are not followed, the payment for services can be recouped retrospectively. Personal support aides provide services, and registered nurse or licensed practical nurse under the supervision of RN provides medical supervision of the personal support service aides. Visit type and goal. Start of care. Administrative visit with no hands-on care. Establish plan of care and to initiate personal support services. Requirement for MedSide to bill for PSS after start of care was completed and client signed service agreement. Follow-up and supervisory visit. Administrative visit with no hands-on care. Determine appropriateness of services provided. Care provided according to the care plan. Aid provides services as ordered. Determine client satisfaction. Requirement for MedSide to bill for PSS. MedSide is forced to place services on hold until visit is done. Supervision. Face-to-face supervisory visits are scheduled every 8 weeks. We don't get paid for the supervisory visits. They are required so we can bill Medicaid for PSS services. Supervisory visits must be completed timely or payments for PSS will be recouped. Employee evaluation are scheduled at least annually. All aides should be evaluated or observed performing assigned tasks per plan of care. Hospitalizations. There are many ways we can be informed of a hospitalization. The PSA client or their family might call office to inform about the hospitalization. Any client's incidents, including fall, ER visits, hospitalization, etc., have to be reported to the state within 24 hours. If the client has been hospitalized, all personal support service visits are on hold until the client is discharged. Do not visit the client in the hospital. EVV, electronic visit verification, is the system that confirms when provider visit occurred and keeps track of the precise time services begin and end. It ensures that members receive the services they are authorized to receive, gives providers, care coordinators, and DCH access to service delivery information in real time to ensure there are no gaps in care, and helps to reduce fraud in home care delivery. Effective 11/1/2021, all personal aides must use MedSide system to log in and out by accessing their schedule through www.medside.com. Each visit must start with clocking into the MedSite system and clocking out once the visit has been completed. Upon logging in, the aide's one-day schedule will appear. The check-in or the check-out location is different from the address on the scheduled visit. It is a question. For example, the check-in will be at the client's doctor's office instead of their home address. What location should be recorded? The check-in and check-out addresses should be the actual addresses where the shift begins or ends and is the addresses that should be recorded. The aide should inform the care coordinator about the address change in advance, preferably 1 2 days, at least 30 minutes prior to starting the visit at the alternative location. The aide should send an email to the care coordinator with subject line address change for the client's name on assigned date, and the body of the email should be per the client's request. The visit will start at such an address and will end at such an address. If the start or end visit is different than it was scheduled, then the visit will be marked as unmatched, and I will have to report, do the internal investigation, and report to EVV the reason why the visit was not done at the scheduled location. EVV utilization. PSA responsibilities. If you are unable to use the system, call the care coordinator for assistance and let the care coordinator speak to the client. If the care coordinator is not available, employee should leave a message with the following info and then let the client to confirm it. Exact time the visit started. Let the client confirm it during the message. Description of the encountered technical issue, what phone number they can be reached at. The PSA should immediately contact the care coordinator in the following cases if either clock in or the clock out was not done using MedSci system, if the visit started outside of 30 minutes range from the scheduled start of the visit, if an employee needs to stay with the client longer than the scheduled length of the visit. The aide should start and finish the visit at the scheduled time and location. The client has to sign at the end of the visit confirming the service delivery. Exceptions are allowed only in case of emergency. Coordinator's responsibilities. Every 30 minutes, visit status report should be run for non-started visits. For visits which have been started within 30 minutes from the scheduled time, call the PSA within 30 minutes. If not answered, call the client or for a sub if available. Every 30 minutes, visit status report should be run for not completed visits. For the visits which are running longer than 30 minutes above scheduled time, call the employee within 30 minutes. Call the client to verify the time of employee's departure. If the client insists that this visit in fact was performed and can provide the exact time of the visit, enter an audit for visit with detailed explanation. However, the visit can be processed for the payroll only after the employees personally contact the office, gives an explanation on the reason the visit was not electronically verified, and corrects whatever technical issues he or she has had. If this visit was not performed, offer to move the visits to another day or mark as missed. Enter visit audit in the system after each call. Goal: less calls from the office to the client. Happy client, stable hours for PSA. Happy PSA. Client's feedback. I cannot say enough good things about the recently started MedSide caregiver for my mom, Adriana Raikova. From the moment she stepped into my mom's home, my mom was greeted with a warmth and enthusiasm. Adriana is attentive, kind, and treats my mom with respect. It is such a relief to know that our mom is being cared for by such a caring person. My family also wanted to thank Natalia, coordinator, who is always helpful and supportive of our needs for my mom. She is always willing to make sure my mom gets professional care needs and on time.